All right, good morning. Thank you and welcome, and thank you for tuning in to WHLI Talk Radio. I'm Dr. Victor Politi. I'm the president and CEO of New Health, Nassau University Medical Center. As healthcare changes in America, New Health is part of that change. This half-hour program will provide you with essential information about our services and facilities that provide top-quality care that fits into your lifestyle. New Health's roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver essential, excellent care to everyone at every stage of life. We're absolutely dedicated to being the healthcare institution that makes the full spectrum of world-class services available to all of Nassau County residents. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. To learn more about New Health or its centers of care, please visit us at www.newhealth, that's N-U-H-E-A-L-T-H, newhealth.net, or call 516-486-NUMC, that's Nassau University Medical Center, NUMC, or 6862. So today, our guest is Dr. Kelley Sookraj. Dr. Sookraj is a surgeon at Nassau University Medical Center. She's been there for quite a few months now. She's new on the staff, but she's making quite an impression at the hospital. And she's a very energetic, highly trained surgeon who's done fantastic things in the short period of time that she's been there, and has really gained recognition and respect of all the seasoned surgeons that are there at the hospital and physicians as well. So, Dr. Sookraj, thank you very, very much for being here today.
Hi, good morning. Thank you for having me. Appreciate it.
Sure. Well, I mean, you're a surgeon, so you're used to working under like the most difficult of circumstances. No one really comes to see you, in a relaxed atmosphere. You're involved in trauma. You're involved in life and death situations, and yet you're so cool and so calm. I've seen you in the emergency department when I've come down there on some trauma calls, and you just take control of that room and you just guide everybody. So, what does it mean to be a trauma surgeon? What kind of training did you have to go through?
Well, my training essentially consisted of me doing a general surgery residency, and I did that residency at SUNY Downstate Medical Center, Kings County Hospital. And following that training, I did a trauma critical care fellowship at Jackson Memorial Hospital Ryder Trauma Center. With that sort of training, it actually is very intense, dealing with life and death situations every day. So I guess I would say it takes a certain personality to be able to be a trauma surgeon, and you hit on some of the key points. It's really, keeping yourself composed and being cool under pressure so you can focus on things that you need to do at that point in time when a patient comes in to the trauma bay, as you've seen at Nassau University Medical Center, and just focus on that and doing what's right to save the patient's life.
So this is a radio show, and people don't really know you or see you, but I mean, I've seen you work in the operating room. I've seen you work in the ER. I've seen very, very severely critical injured people come in that ER, and I've watched you and your hands go to work, both in the emergency department and upstairs in the operating room, where you've done amazing things to people. And then I've seen those patients walk out of that hospital. And Kelley, I mean, it really is, if in truth, and like I said, this is a radio show, we're talking, but your hands have really, and your training have really come, it really helped a lot of people. And so where'd you go to medical school? Where'd you grow up?
So I actually was born in the Caribbean,
Mm-hmm.
and we migrated to New York when I was a kid.
Okay.
Lived in Brooklyn.
All right.
Most of my life, and then we moved to Queens. And I actually did most of my education and training in Brooklyn and Manhattan, and went to medical school actually at SUNY Downstate Health Science Center,
Mm-hmm.
and continued my residency there.
Fantastic. How long have you been at Nassau University Medical Center now?
Approximately 6 months.
6 months.
Yeah.
Right. So, I mean, in 6 months, you've done great things. So, what do you think of the hospital? 6 months, Nassau University Medical Center. I mean, here we are, huge 19-story building over in East Meadow on Hempstead Turnpike, tertiary care center, and you're part of it now. So, what's your thoughts on the hospital?
I think it's an amazing place to be and to work at. The population that we serve really is in dire need of healthcare, and I think we provide that great quality of healthcare for people who would not otherwise have access to it. Being a trauma surgeon, the type of patients that I've treated during residency and fellowship is very similar to the patient population that we have at Nassau. And it makes me feel good to be able to give back to such a community, especially people who don't have that access. And it's what we do is something great, I think. And I'm proud to be part of that sort of physician and surgeon staff at Nassau to provide that health care for patients.
And that's true. I mean, most people don't recognize now, and they don't know what NUMC is about. And they think it's still that public hospital on Hempstead Turnpike, but it's really evolved.
I think so.
Over a couple of years. I mean, the ER is probably the best ER in Nassau County. It's large, it's airy, it's got all individual rooms. It's not like rooms with curtains between stretches. Everyone has their own room. They even have their own television in their rooms, which is unusual for an ER.
And they have their own trauma bay.
And beautiful trauma bay, and a couple of resuscitation rooms. Actually, little operating rooms right down there in the emergency room. But on top of that, we have all top board certified ER docs. And all top nurses that went through their trauma nursing critical care classes and certified, and a completely separate pediatric ER for the kids, so the children aren't mixed in with the adults. A completely separate area with pediatricians. I mean, they actually see board certified pediatricians. And so I mean, people don't really know the what we bring to Nassau County, and when you are there, when doctors come on board like yourself, or maybe Dr. Elizabeth Fontana or Dr. Angus, so these doctors that are unbelievably trained and highly qualified, people don't know that. They just know that when they come to that hospital, they expect the best. And it's my job as a CEO to make sure they get the best. And
I think you've done a phenomenal job with that. I mean, recruiting individuals like Dr. Angus, Dr. Fontana, myself, we're all academically trained physicians and surgeons who provide the best quality of care for our patients, and those are the resources that are available at Nassau University Medical Center.
And we just brought a new trauma surgeon on board, Dr. Gupta.
Correct.
Right? Another really amazing doctor who just came on board and, again, is making himself well known in the community. I mean, I know the fire services and the police services in Nassau County, I mean, they love the hospital. They're the ones that bring the patients in that are critically injured, and they're the ones that want this person to live and want them to get the best care. They bring them to us.
True, and you make an amazing point, and that's the pre-hospital care, which is provided by our EMS service, and we actually work very closely with them and train with them while they're at Nassau. So, and it's true, we all want the same thing for the patient, which is to see them live and walk out of the hospital alive and well.
Right, because I mean the Fire Police Academy is at NUMIC. NUMC has the Fire Police Academy in there where they train the EMTs and the paramedics for Nassau County.
That's right.
Right here in our facility, and then they do train with you in the operating room and in the ER.
And we do advanced trauma life support training with them as well.
You do the ATLS stuff. Right. So, I mean, it's amazing that we have that relationship with the fire and the police, and we know they look at us as their hospital, and they bring us the most critically injured patients because they know they're going to be seen by doctors like yourself, and they're going to go to a brand new intensive care units after they come out of the OR, and that they'll go to physical therapy afterwards. And I know that your patients, you do amazing work. You open up their abdomen and you get your hands in there and you fix their spleen and you stop the liver laceration and you sewed up some guy's diaphragm and all this other good stuff. And that's great. And then the ICU gets them back on their feet, and we send them up to our physical medicine and rehab, which is one of the United States top 10 or top 100 best. I'm sorry, U.S. News and World Report top 100, and they do an amazing work of getting our patients back on their feet, walking and doing their activities of daily living. Better than anyone. I mean, other hospitals in Nassau County send their patients to us for physical medicine rehabilitation to get them up and on their feet and to see them walking. How does it feel when you saw one particular patient walking out of that room, out of that hospital on his own? How'd you feel?
It was completely amazing. I know that particular patient that you're referring to, and to see the way that he presented to us in the trauma bay and everything that he went through in the operating room and the ICU, and then the amount of time that he spent in rehab. They did an amazing job, and to see him leave and do well was truly an amazing thing. And I think you really brought up the key point, is that it's a team effort, and it's team that actually takes care of all these patients, and having everything set up as we do at Nassau University, from when they hit the doors, pre-hospital care with EMT, and then the trauma bay, going straight to the OR, doing what I do as a trauma surgeon, and then having the ICU available and rehab, everything set up so that when our patients need this to get them better and leave, it's all set up so that, they go from one avenue to the other to get their care, and as you said, get back to some semblance of normalcy in their ADLs, which is what we strive for.
And not so much in this particular case, but in a lot of the patients, they're in a drive. These people that come in injured, we could do all we can as doctors, but there's two people that have the biggest influence. One is the patient himself, and
that is true.
He's got to have that energy and drive to want to get up, and the determination to get out of that bed and to walk and to be back to the condition that he was before the accident.
Correct.
And we see that time and time again, whether it's a motorcycle accident or an elderly trip or fall, a fractured hip, that we encourage these people and we give them the strength and the motivation to get them going. Right. But it's inside. And that other person, we all know, is watching over all of us
Correct.
at all times.
Someone who's intangible.
Yeah. and as a doctor, we've seen amazing things happen that shouldn't happen, and there's no explanation for certain things, and thank God for that.
Exactly. Thank God for that.
But it's amazing that the hospital itself can provide that level of care in the emergency department, the operating rooms, the ICUs. We just opened a brand new primary care center, as you know.
Correct.
So it's more to just the operating room. You also see them in the primary care center. So you follow surgical patients, and it's a brand new, I think it was $25 million clinic or primary care center that we opened up for women's health, medicine, and pediatrics, which opened up a whole beautiful area for the surgical guys. So how's your primary care center working over there, your surgical clinics?
Our clinics are great, and that's actually one of the reasons I became a surgeon. Surgeons have this innate personality where they need instant gratification. So that's the operation that we perform, right? And we see that dramatic change right in front of us. But we also have the opportunity to manage patients' medical issues and also follow them with continuity. And this is where we see them in our clinics. And our clinics at Nassau University Medical Center are always busy. And, we have amazing populations that come in, and we see them after, whether it be their trauma operation or their surgical operation or referrals from other primary care clinics, and it works phenomenally. I think the setup for our clinics are great, and we can always interpose between surgery clinic, or if we need medicine referrals, everything is available right there for our patients.
Yeah, because we've been talking about, God forbid, the accidents and, people coming into the emergency room with ambulances or helicopters. Helicopters.
That's true.
Helicopters.
The
helipad. The helicopters are landing all the time. As a matter of fact, when we had the debate, or when any time heads of state come to Nassau County, we're the receiving hospital for the, if it was, God forbid, something happened during the debate, Secret Service, we have a separate place just for those people at that hospital. It's a critical infrastructure in Nassau County. It is providing huge resources not only as a hospital, but in things like Stormy Sandy, when we had this Superstorm Sandy. We were high and dry, and we received all those patients from down in the Long Beach area and other areas, and we opened up our A. Hallie Patterson nursing home, skilled nursing home, to receive patients from nursing homes that were in danger of flooding. So we are a critical infrastructure. We provide a very vital service to the people of Nassau County, and the primary care centers and the clinics. So besides those disasters and those traumas, people that have pains, abdominal pains, or surgical issues, do we see them as well?
Of course, we see all sorts of patients with abdominal pain or surgical issues, whether it be general surgery or actually specialized peripheral vascular disease. We have vascular clinic there. We also have our bariatric clinic there. So we see all multitudes of different types of surgical patients in our clinics.
Right. So bariatric is, what kind of clinic is bariatric clinics?
It's a specialty clinic that actually is run by one of our bariatric surgeons, Dr. Sastacona there. And everything is set up for that specialty, where we have a nutritionist, a dietitian, and these patients come in, they get their referrals, they're seen, they're worked up, and they are followed through in the bariatric surgery clinic pre and post surgery.
So these are people who are morbidly obese, people who are very, very out of shape, very, very heavy, and they've tried dieting, they've tried just about everything to lose weight, and now they're going for the surgical procedures.
That is true.
And the surgeons we have, he's a certified, board certified, top
Laparoscopic and bariatric surgeon.
bariatric surgeon, and we provide that service at Nassau University Medical Center.
Yes, we do.
So if they get online or call that number, they could arrange an appointment to see that doctor to follow up
Absolutely.
on his bariatric care.
Absolutely.
And then you mentioned vascular. What is a vascular guy? What does he do?
So patients who have medical problems such as diabetes, hypertension, also or cardiac issues will also have an effect on their blood vessels.
Okay.
So vascular surgeons will take a look at the blood flow if patients have any pains or anything in their legs.
Right.
And then they'll do the essential workup when they see them in clinic. And if they need any sort of surgical procedure or any sort of intervention, whether it's medical where they change their lifestyle, smoking cessation, diet, exercise, or if eventually they need surgical intervention, that's where the vascular surgeon comes in and will see these patients and give them the options.
So we have actual specialty clinic for vascular issues with a board certified surgeon
Correct.
in vascular medicine, and they'll do all those tests like for varicose veins or for
Yes.
clots in their legs or any types of circulation. Like a lot of people have diabetes.
Yes.
So the diabetics are notorious for having poor circulation down in the lower extremities. So
Exactly,
they'll
you do.
they'll examine those legs and feet and vessels of these patients.
Yes, and work them up to see if there's anything that needs to be done surgically.
And that's so important. We all know diabetics, they have horrible circulation in their lower
Yes, they do.
extremities. And if they get an infection, they could lose their feet or their whole foot from a horrible infection. And
That
so,
is true.
I mean, you and I, both doctors, and I would urge, and I do urge my patients that are diabetic patients to make sure they have good foot care and that they go to see a vascular surgeon
Absolutely.
to evaluate those vessels. And how about the carotids, carotid arteries, for stroke prevention?
Correct.
Same thing, right?
So it's the same thing, and actually our chairman, Dr. Faust, is a vascular surgeon, and he does carotid endarterectomies. And he also has clinics where these patients will come in, and if they have any symptoms, they'll get worked up with ultrasounds of the neck to take a look at the carotid artery and go from there.
What's some of those symptoms?
If they have any sort of lightheadedness, dizziness, visual changes, or if they have any sort of TIA, which is prior to having any sort of stroke. These patients have slurring of speech, facial drooping, lack of sensation. All these things will point to any sort of carotid disease, and they should obviously come to the emergency room first
Right.
and get seen there and taken care of, and then they will get the vascular service involved, and we will follow up with the vascular surgeon at that point in time.
Right. So anyone who has any of those symptoms really should go to the emergency room,
Correct.
especially if they think they're having a stroke,
stroke.
right?
That is true.
Dizziness, weakness, and any of the the dizziness or weakness, maybe it's involving the carotid
Right.
artery, and they need to have that evaluated. So patients who are at risk, smokers, heart attack, patients who are
Diabetics, hypertensives.
yeah, they should make an appointment to come see their doctor. To
Absolutely.
have that evaluated for a carotid endarterectomy, which is sort of like the roto-rooter of your arteries in your neck, right? To
That's
open it
true.
up so that blood could flow very, very freely up into the brain,
brain.
preventing strokes and all sorts of horrible things.
Exactly. And
yeah.
that's the neat thing about Nassau University Medical Centers. We have all of those services available at this tertiary center.
Yeah.
So, you come in to be seen by your primary care with any sort of symptoms, and any specialty service that is required is available at Nassau.
So Nassau University Medical Center, one phone call, and basically you can
Get your entire self taken care
take
of.
care of yourself. But people don't take care of themselves. They really
don't.
don't. I mean, there's different things that really. People have a long longevity. They could live for a long time if they take care of themselves, and dieting and exercising and no cigarette smokes and watch what they eat, and just routinely following up with their primary care doctor, their physician. I mean, it's so important. And we serve a vital purpose as a hospital, and a lot of people don't have doctors. A lot of people don't know where to go, and all they have to do is call and say, "Hey, I want an appointment with a primary care doctor." And
Correct. And they'll get, plugged into our system and then have other specialty services available to them.
and if they don't have insurance, we could help them get insurance.
Absolutely.
And patients that are uninsured, these are patients that are undocumented. We welcome them. That's part of our mission.
Absolutely.
Our mission is to take care of all people. No matter what their financial class is, no matter what their social status is, we want them at the hospital. We
That is
want them
true.
there, and we want to take care of them. And the amazing thing is, they're going to get doctors like you. They're going to get doctors like Faust. They're going to get doctors like Elizabeth Fontana and Paul Mustakia and Lynn Weiss. I mean, these are such world-class physicians that, I could be very, very honest. I would bring my family to any one of them. I would be, my father, even my daughter. Second there. They're that good, these doctors. I mean, I don't think anybody can give a better testimonial than that.
I don't think so. Thank you. I really appreciate that.
You
That
know what I
speaks a
say?
lot.
And when I see you on weekends, I always ask her, I said, Doc, are you on call this weekend?
That is true.
It is true.
And I'm usually, the answer is yes.
Yeah, and then I always I say, you know what, the people in Nassau County are going to be, are going to be safe this weekend if you're behind that scalpel. So
Thank you. I
it is
appreciate
amazing.
that.
And so everybody watches these TV shows, right? Watching Chicago Med and ER and all those things, and like you're right out of that show. I mean, you belong on that TV show because you have the personality, the attitude, the look. You got the whole attitude of a surgeon. So you ever watch those shows?
I have to say, in all honesty, the only medical TV show I've ever seen a few episodes of has been Scrubs.
Me too, actually. I like Scrubs. Scrubs is the most realistic, I think.
I think so too, and
Yeah. But it's amazing though when people see these shows and they're watching them and they see the surgeons, do some amazing things. I know it's fiction, but in reality, in the hospital, you do see some really amazing things, some really crazy things, and you're able to put that together. I mean, what's it feel like to be a surgeon in that operating room?
When I do what I do, I'm actually just in that zone, doing my job, what I've been trained to take care of, which is my patients' lives. And when I'm in the operating room, I just focus on what I need to do. It's only after, when my patients walk out of the hospital alive and well, then, I reminisce about exactly what it was that brought them in and what myself and my entire team did. And it's just amazing sometimes to realize that this is what we do. Sometimes I get taken aback by, the things that I've been able to accomplish. And I can only say it's with my phenomenal, amazing training and that intangible person above who watches over me that gives me the ability to do what I can do.
It's true, and I've seen you work. It's amazing. It really is, and it's a lot to be said for your mentoring and your training that you received at Downstate, and the amount of schooling that you did receive. But to be a surgeon and to be in that degree of stress. I mean, you have a guy who's intubated on a machine, ventilating him, and you're opening up his chest or his abdomen, and you're going inside there. You are definitely a cool hand, Luke. I mean, to get in there and actually do that type of work, and I guess, like you said, you get tunnel vision. You go back into your training.
Correct.
Is that really?
I think that's really what it is. I did 7 years of general surgery residency, albeit a couple of years was basic science research, and then my trauma critical care fellowship. And I was actually fortunate enough in residency and fellowship to actually be at two amazing places that were very, very busy in terms of penetrating trauma. So getting that operative experience was key. So it just takes you back to that, level of training. When you're in the operating room, you're focused and you know what you need to do. Stop the bleeding first, then you fix everything else, and then you live to fight another day. And it really, I really am set in that zone, focusing on what I need to do. So if it's, taking out the spleen first, stop the bleeding, fixing the liver laceration, sewing up the IVC, get that done. At the same time, it really is a team effort because you work closely with your anesthesiologists to make sure that the patient's adequately resuscitated with blood products, making sure that the room is at an appropriate temperature to avoid any sort of hypothermia or acidosis, just to make sure that the patient's okay and normal. And then once you get that taken care of, then you take them to the ICU. And that's the other part of my training. I'm a critical care intensivist. And with the amazing team that we have there, led by Dr. DiGiacomo, our ICU director, the patients really get the quality of care that they deserve. And it's actually the most important part of their care. It's actually the intensive care part of it. And, it really is just focusing on doing what's right by the patient to make sure that, you get them through this and their family as well. And then you see that day when they walk out of the hospital alive and well.
And and you mentioned Dr. Giacomo, and there's no one who's more on top of the patients than Dr. Giacomo. If I see him every day and he's asking for something or he's talking about something that to make that intensive care unit better, he is all over those patients.
Correct.
He is a full-time trauma critical care surgeon, MD surgeon that is on top of
Yes,
these
he is.
patients. And he just made us open up a new area called the spa. What is the spa?
So it was touched on earlier. We have a large population of geriatric patients, and they require a lot of basic intensive nursing care after their critical care stay in the ICU. So the spa is this area where patients can go to recover, where they still need a little bit more nursing care, but they're on a diet. They're getting ready to go back to rehab or subacute rehab, and it's an amazing place for these elderly patients to go to as just a stepping stone before they go off to their rehab.
What does spa mean?
It's surgical post-anesthesia.
Surgical post anesthesia, and we initial it as spa.
Spa.
And I know they painted it like really soothing colors, and they have
Correct.
special nursing and physical therapy staff that are there.
Correct.
And so it's for, like elderly people, they fall down, they fracture their hip, or they have some sort of trauma,
Right.
and they need that extra care. And
Extra
instead
care.
of going right from intensive care to a step down floor, they have this hybrid unit. Like it's
Exactly.
not an ICU, not intensive care unit.
And it's not exactly the floor.
And it's not the floor.
Right.
And they get extra care and you get them up. And do we find that the patients respond better to that?
They've been doing amazingly well in the spa. And, you touched on it, the different colors, the soothing colors, having a television there. They're sort of getting back to some semblance of normalcy for them, what they normally do in their routine, which is what they need. Because in the ICU, when you spend a lot of time there, you develop something called ICU psychosis and a little bit of delirium. And the best thing is after they spend their time in the ICUs to go to the spa rather than the floor, and they'll help get back to some semblance of normalcy and their routine before they actually leave the hospital.
Yeah, I mean, because he's doing calometric testing on every patient
Correct.
to determine, even when they're on a ventilator, what their input should be and how much nutrition they should be receiving.
right.
I mean, the really amazing work that he's doing in that intensive care unit, and his team, of course. I mean, listen, none of us are any good as doctors without the nurses, and let's admit that right now.
That's true. Absolutely, 100%.
It is the nurses and the PCAs and nurses aides
The
and
ancillary staff is very important.
those are just as important as any surgeon in any emergency room or any hospital, because
That's right.
once we get them on their feet, it's those people that are the most dedicated angels in that building.
That is true.
And it is true. And as doctors, we know that. And we see that.
We absolutely do.
Yeah. We don't like to tell them that too much, but we should. We really should. But, they are the backbone of that hospital. And it really brings a lot of, it really helps the patient to heal and to
Absolutely.
recover. I mean, we can only do so much as doctors,
Right.
So, I mean, what's next for Dr. Sookraj? I mean, here you are. You're doing a great job.
Thank you.
And are you going to do some research? Or
Absolutely. So we do have a research department in the Division of Surgery and a research fellowship. Having the fortune of doing both basic science and clinical research, part of my goal is to actually implement education and research with the residents, and it's something that we're actively working on right now.
Yeah, we do have a great residency program. We have residents in general surgery. And,
Correct.
we also we didn't talk about it, and we're running out of time, but we could have talked a little bit about our burn unit and our burn
That's right.
fellows, because we do have the only burn center in Nassau and Suffolk County.
Correct, and hyperbarics as well.
We have hyperbarics, and we have the only multi-place hyperbaric chamber, other than, I think, Jacoby Hospital in the Bronx has the other one. And a lot of times they're closed, and they ship those patients from the Bronx to us. And we could, and when we talk hyperbaric, it's not just the tube. It's the actual a room that looks like a little submarine.
Yes.
We can put like 8 firemen in it, or if people come
Yeah.
overcome by carbon monoxide, we can put them in there, and it's really, very, very widely used in burn patients.
Absolutely.
And we have those.
Or patients with non-healing wounds,
Yeah,
vascular patients, things of that nature. I mean, we really are a wealth of a resource.
Yeah, we are.
in
And
East
there's so
Meadow.
much. I mean, I know we published like 20 articles this year already. I mean, there's so much we
Absolutely.
want to talk to, but we're running out of time. Will you promise to come back on the show and we could take this take it bit further.
To the next level.
Yeah,
I promise.
Because I mean, we didn't talk about the residency, the burn fellowships we mentioned, the geriatrics, the bariatric stuff we touched
Bariatrics,
on.
vascular,
Only the vascular.
parathyroid, thyroid.
Right.
Dr. DiGiacomo also does
Giacomo,
that. So
amazing. We have such great guys. So, I want to thank you very much, Dr. Sookraj, for not only being on the show, but for being here at National University Medical Center, and for putting in the amount of hours that you do, and the amount of days that you're in that hospital, and the hours. I see you there 8, 9, 10 o'clock at night, weekends, Sundays. Thank you from the bottom of my heart, and thank you for being here.
it's been a pleasure. Thank you so much, Dr. Politi. I appreciate it.
You're welcome. So, I'm Dr. Victor Politi. I'm the president and CEO of Nassau University Medical Center on Hempstead Turnpike, a place that I can honestly say I'm very, very proud to be the CEO and honored that I'm there and helping doctors like Dr. Sookraj perform her duties, which they do so amazingly. So, thank you all for listening, and we're looking forward to hearing from you. Looking forward to speaking to you shortly. Bye.